Agustinelli, Social Media Manager at Greenway Health, and this is Putting Possibility into Practice, the podcast from Greenway Health. And today we are talking about a software partner that puts you first. Anna Mansour is the Senior Solutions Consultant with Greenway Health, where we focus on the ambulatory market, creating cloud-based EHR solutions for tens of thousands of providers across more than 40 specialties. And today we are discussing Greenway Intergy and how Greenway can partner with your practice to expand possibilities in care. I thank Anna for taking time to join the podcast today. And first, Anna, let's start off easy. What is Greenway Intergy?
Greenway Intergy is our best-in-breed platform, which has plagued practices most over the years. With an electronic health record and practice management, a team approach typically works best. When you partner with Greenway Health and our Intergy platform, your entire staff will work in tandem with our EHR software development team. The result is called our Intergy functionality, and which is powerful, effective, and a practice management solution in EHR for both large and small practices.
What are some of the add-on features that are available for Greenway Intergy for practices once they get on board?
I always love talking about the add-on features. It's not just what we're shipped with, but it's what's going on kind of outside. And I would say that some of the major items, not regarding federal and regulatory enhancements, are the patient engagement outside the four walls of your practice. People have high deductible healthcare plans. They want communication with their physicians. You've seen this trend in concierge medicine, but Greenway allows you to achieve greater efficiency and enjoy user-focused simplicity, the front office, clinic, and back office. With patient engagement, we've simplified that process. We've given your patients tools like text message appointment reminders, birthday reminders, recall notices, information about their labs on text. I don't know about you, Joe, but it's hard for me to answer the phone. I don't really even like to pick it up, especially outside of working hours. Getting a text message, I can respond to while I'm doing this podcast. I mean, we're in this multi-dimensional, multitasking atmosphere now, and patient engagement's a big part of that.
In relation to the features and the add-on features that are available, how customizable is Intergy for practices, no matter what their specialty is?
So a question frequently asked are, can we change and edit things like clinical alerts? Not everyone is an internal medicine or family practice. So we can, of course, the product is flexible in usage and design. We run off the medicine database, so you have that codified data. But it's basically like us giving you templates to work with that are customizable and flexible for your practice. Every physician documents different. If you saw me surf the internet, Joe, you might go, wow, Anna, we could do things a lot differently here. And I might say the same thing to you. So, at the end of the day, we all have the same goals, and those are to have better patient care, as well as do things like have interoperability, third-party software solutions. But our product is customizable and flexible, and that was one of my favorite parts of being a trainer, was helping implement those needs and seeing the satisfaction on the practice's faces.
And how are updates made available to providers once they're on board?
We do 2 updates per year with our Intergy platform. Of course, multiple hot fixes out per year. Each enhancement is something that a provider can choose, whether they are on a hosted or on a server platform. What makes this easy to implement in these upgrades is that we give you what we call release notes, and we go through overview, new features. You can see what's new from version to version. So I think a great way that we do this is 2 times per year with multiple webinars and training opportunities throughout our unique customer community.
And a provider who might be thinking of switching over to Intergy, should they be concerned about migration, implementation, or training for their team? And you touched on a little bit about this in your previous answer.
I mean, with any new system and any migration, there are some, hurdles to overcome, and we've really simplified the process. It's all about easy documentation and easy template management. A migration is something that we take seriously here, especially if you're coming from electronic records and moving electronic records. Most electronic health record platforms now handle exchange documents with discrete data, and that's the way that we handle things, gently and discreet. So, with that being said, we do have a training process. Our trainers have an average tenure of 10 years or more, so they're very well versed in Entergy. You have a project manager that manages the project. Our training is done live or it can be done remote, kind of like the way we're talking here, Joe. We may not be in the same room, but we're talking to each other remotely. I can also see what you're doing on your end to make sure that we're meeting the same goals and deadlines. So migrations, of course, with any change can be difficult, but we really handle that with care and gloves. And our advice to you is to trust us. We are your partner in this, and we value that relationship.
What support and security is available for Entergy once I'm on board?
So we've got U.S.-based support, and our support is available to you in multiple ways. You can call a number. We have a 98% first call resolution rate. And what makes this different is that we want to concentrate on that 2% that we're not getting right. Most people would toot their horn at that 98%. But we are your partners. And another relationship piece is that in your Entergy product, you can do basically like an instant message to your support technician and type to them. We want you to be able to concentrate on working in your product, and typing to us or doing interactive chat is nice. So different ways to be able to contact support. Remember, we're your partner in this, and we want you to be successful using a system that is accessible, regulatory ready, and able to capture the data for value-based care programs. You're going to have accurate documentation, simple scheduling, so you can achieve greater efficiency.
Great. Thank you, Anna, for all that great information about Greenway Entergy. If you would like more information about Greenway Entergy and the product solutions that Greenway Health offers to physicians and providers, please visit our website at www.greenwayhealth.com. Once again, I thank Anna Mansour, a senior solutions consultant with Greenway Health, for joining me on our podcast today. Once again, I am Joe Augustinelli, the social media manager at Greenway Health. This has been Putting Possibility into Practice, the podcast from Greenway Health. I invite you to subscribe to the podcast either on SoundCloud or on Google Play or Apple iTunes. Thanks for tuning in.